Post-traumatic stress disorder, or PTSD, is a mental health condition that can develop after someone experiences or witnesses a traumatic event. This could be combat, a serious accident, an assault, or a natural disaster. It's a complex response to overwhelming stress. PTSD is not a sign of weakness. It's a natural, though challenging, reaction the mind and body can have when trying to cope with trauma. Understanding it is the first step toward healing and support. PTSD occurs when the brain struggles to process a traumatic experience effectively. It's more than just remembering a bad event. It involves a persistent feeling of being in danger or reliving the trauma. Symptoms often fall into four main categories. First, intrusive memories, which include distressing thoughts, flashbacks, or nightmares that feel very real. These can happen unexpectedly. Second, avoidance. This involves actively trying to steer clear of anything that reminds you of the trauma, whether it's people, places, conversations, or even certain thoughts. This avoidance can significantly limit daily life. Third, negative changes in thinking and mood. This might manifest as persistent negative beliefs about oneself or the world, feelings of guilt or shame, or a reduced ability to feel positive emotions. Emotional numbness is also common. Fourth, hyperarousal. This is a state of being constantly on edge. Symptoms include heightened anxiety, irritability, difficulty concentrating or sleeping, and an exaggerated startle response. It's like the body's alarm system is stuck on high alert. These symptoms can vary greatly from person to person and may change over time. Sometimes symptoms might not appear for months or even years after the trauma occurred. The duration of PTSD is highly variable and depends on many factors. There is no single timeline for recovery. The nature of the trauma plays a role. A single event might be processed differently than repeated or prolonged trauma. Trauma involving intentional harm can also have unique impacts. Individual differences are significant. A person's inherent coping skills, their history of previous trauma, and the strength of their social support network all influence the path of recovery. Engagement in effective treatment is crucial. Starting therapy and other interventions early can often reduce the severity and duration of symptoms. For some, symptoms may improve significantly within months of starting treatment. For others, managing symptoms can be a longer journey, potentially lasting for years. A small percentage may face long-term challenges. The impact of PTSD extends far beyond the initial symptoms, affecting many aspects of a person's life. It can strain emotional well-being profoundly. Persistent feelings of fear, sadness, or detachment can make it difficult to maintain relationships and function effectively at work or school. Everyday interactions can become challenging. Chronic stress associated with PTSD can also affect physical health. It may contribute to issues like headaches, digestive problems, or an increased risk of cardiovascular issues over time. Behavioral changes are common as individuals try to cope. This might include increased substance use, engaging in self-destructive behaviors, or taking unnecessary risks as a way to manage overwhelming feelings. Social isolation often results from avoidance behaviors. Withdrawing from friends, family, and social activities can deepen feelings of loneliness and alienation, creating a difficult cycle. While there isn't a single cure that works for everyone, there are highly effective treatments available for PTSD. Recovery is absolutely possible. Psychotherapy is a cornerstone of treatment. Approaches like cognitive behavioral therapy, or CBT, and eye movement desensitization and reprocessing, known as EMDR, help individuals process traumatic memories in a safe environment. Medications can also be helpful. Antidepressants and other prescribed medications can assist in managing symptoms like anxiety, depression, and sleep disturbances by helping to balance brain chemistry. Strong support networks are invaluable. Having continuous support from family, friends, and participating in structured support groups can significantly aid the recovery process and provide a sense of connection. With the right combination of treatment and support, many people experience a significant reduction in their PTSD symptoms. Some may have lingering effects, but these can often be managed effectively, allowing for a fulfilling life. Detecting PTSD typically involves a careful and comprehensive process conducted by mental health professionals. It's not something diagnosed lightly. A clinical assessment is essential. Trained professionals conduct thorough interviews to understand a person's history, experiences, and current symptoms. They use standardized diagnostic criteria, such as those found in the DSM-5. Self-reporting tools like questionnaires and surveys can help identify potential symptoms and their severity. However, these tools are screening aids and require interpretation by a qualified professional for an accurate diagnosis. Observation of behavioral changes by loved ones or professionals can also be a key indicator. Significant shifts in mood, behavior, and overall functioning often signal the need for a professional evaluation.